Hi, my name's Ty.
And I'm Zinnia. We were chosen as student leaders to attend the 2023 OCCJ Youth Leadership Forum. The Oklahoma Center for Community and Justice hosts programs to educate and empower teens to become social justice leaders in their community.
Each delegate at this forum was challenged to create an educational project that would share information about racial justice issues in our state. We chose to focus our project on racial disparities that affect the health of Black families in Oklahoma City. And since we are both Jewish, we look to our faith tradition to help guide us towards social justice solutions, or as we like to say, the modern day promised land.
Infant mortality is the number of babies that die before age 2. Oklahoma currently ranks number 1 at having the highest Black infant mortality in the United States. This means that Oklahoma is the riskiest state for a Black child to be born in. Black babies in the United States are 250% more likely to die before age 2 than white babies. Each year, 345 babies in Oklahoma die before reaching their second birthday. Even though only 13% of the population is Black, Black babies make up 22% of infant deaths in our state. Each year, 75 Black families suffer the loss of a baby, one of the most traumatic events that can happen to a family. Maternal mortality is the number of mothers who die during pregnancy. Black mothers in Oklahoma City have higher risk of dying than almost any other area in the United States. Black mothers in Oklahoma die 3 to 4 times more often than white mothers, and most of these deaths are completely preventable if these mothers had received proper health care. Oklahoma County is the highest risk zone in Oklahoma for mothers and babies. The March of Dimes gave Oklahoma's report card a grade F this year. The report advises that the changes Oklahoma could make to improve their grades would be to pass Medicaid expansion to provide health care for mothers 60 days past birth, and pass Medicaid coverage for midwives and doulas. Black mothers and babies have improved health when they are cared for by Black doctors and midwives. Stress is the number 1 risk factor in all of these deaths. Systematic racism creates a stressful environment that damages vulnerable Black moms and babies and prevents them from being healthy. Section 2, Judaism teaches lessons from Torah to help us create values that improve our lives today. Moses' life offers us 4 lessons that can help us act on this problem. I'm going to be tackling Lesson 1, Moses was born to a mom in crisis. Moses was born illegal. Pharaoh had ordered that all Hebrew boys would be killed at birth. Moses survived because 5 women chose to disobey the law. The Hebrew midwives, Shiphrah and Puah, disobeyed the law and refused to kill the baby boys. Then they lied to Pharaoh to protect the Hebrew women and babies. This was the first example of civil disobedience in the Torah, and probably one of the first documented cases of civil disobedience. Moses' mother, Yocheved, had faith and bravery to make the tough decision to place Moses in the basket in the river to try to save his life. Pharaoh's daughter chose to break her father's law by saving Moses and raising him as her own child. She chose to save a child who was not her race, and she must have defended him all his life. Miriam bravely followed baby Moses' basket and spoke up to Pharaoh's daughter to keep her mother involved in caring for Moses as he grew. None of these women alone could have saved this baby. They all had to work together to protect him. Yocheved, as the mother, needed all these other women having her back and helping her out for Moses to survive. We could use this story to show us that today, if we want Black babies to survive, we all need to work together as a team. Black moms are going through the stressful crisis of racism. Black moms need people of other races to have their backs and to help them protect their babies. Justice means all races need to work together to fight racism.
The Hebrews cared for their non-Jewish neighbors during the 10 plagues over Egypt. As many people might know, the 10 plagues happened in the book of Exodus. The story tells of how Adonai sent Moses to free the Hebrew people from slavery in Egypt. The 10th plague was the death of the firstborns. The Hebrew people were told to make a sacrifice of a lamb and to place the blood around the doorposts of their home to protect the firstborn children inside from the final plague over Egypt. However, we know that when the Hebrew people left Egypt, they were referred to as the mixed multitude. This likely means that the Hebrew people explained to their trusted non-Jewish neighbors the instructions from Adonai and shared the information on how to save their children, leading those families to eventually join the Hebrew people on their exodus. We learn from this story that community justice means neighbors sharing education and information for survival along the way, not restricting it.
Moses had a mixed-race marriage. The Torah tells that Miriam and Aaron gossiped against Moses and called his wife a Cushite. At the time, Cushite was used to describe a group of people with dark skin. The text seems to show that Miriam and Aaron were speaking negatively about Moses' wife because of her skin color or race. Adonai takes a stand against this kind of discrimination and punishes Miriam for this hurtful gossip. Miriam's punishment is a physical illness, a skin disease that turns her skin white with scales. If we think about punishment fitting the crime, the fact that Miriam is stuck with a physical illness would imply that gossiping and discrimination causes physical illness in the victims. Justice means acknowledging that racism and discrimination causes physical illness to minorities.
Moses led the former Hebrew slaves to the Promised Land. Historically, Moses is an important role model for Black Americans. The descendants of former slaves in America saw the American dream as their vision of a promised land. We see this imagery used in many civil rights speeches during this era in American history. In his final speech before his death, the Reverend Dr. Martin Luther King said, "I've been to the mountaintop. I have seen the promised land. I may not get there with you, but I want you to know tonight that we, as a people, will get the promised land." Black Americans still don't get an equal share of the American dream they were promised so long ago. The promised land for contemporary Black Americans would probably include safe living environments, access to good medical care, and education, and freedom from discrimination. We learn from this story that justice is creating a promised land for everyone. We can help to make the world a better place for our Black neighbors in Oklahoma City. Leading Ladies for Healthy Babies is a grassroots organization in Oklahoma that is trying to decrease the Black maternal and infant mortality rates in Oklahoma City. The rate of Black infant death in Oklahoma City has been increasing every year since the year 2000. That's 23 years of constant increase. In 2015, the March of Dimes, an organization known for trying to prevent premature births, sponsored a local summit to look for solutions to the problem. The problem of babies dying is an extremely complex issue with many different triggers and risk factors such as premature births, low birth weight, birth defects, exposure to smoke and chemicals, malnutrition, unsafe sleep areas, unsafe car seats, sudden infant death syndrome or SIDS, and families being under stress. Saving babies means addressing all of these problems, but they are not easy issues to solve. After the summit, stakeholders in Oklahoma came together to create a group called the Infant Mortality Alliance. This alliance decided to coordinate several different local groups to each work at different aspects of these problems. In 2016, a group of local Black women leaders with ties to the public health community got together to create one of these small groups. These women realized they were all leaders in their own churches. Black churches often call their female leaders leading ladies. These leading ladies were all mothers, and they had experience working in social services and public health. They realized that they could use their expertise and leadership skills to mentor young women in their churches and help them to have healthier pregnancies and, in turn, healthier babies. They reached out to other churches and found women there who were also willing to help mentor their young women in their communities. Today, the Leading Ladies now represents 20 Black churches in Northeast Oklahoma City. Each church has a leading lady who receives education and training to give resources to help the young mothers in their church. Each church has an emergency closet stocked with important items like diapers, clothes, formula, and wipes. These leading ladies help to make sure that mothers in the church have the items they need to care for their babies. The mothers and their mentors are invited to group activities to give further support and education and to get bigger supplies like safe cribs and car seats. These leading ladies are given training to try and help their young moms during times of stress. But dealing with stress is one of the hardest things that mentors have to deal with at all. It's hard to help a young mother dealing with stress when you don't have anything useful to hand her to help her deal with said stress. Our project was created to educate our Sunday school class on issues related to Black maternal and infant mortality in Oklahoma, and to perform a service project to aid the Leading Ladies for Healthy Babies mentor group. We decided to build crisis kits that would bring education on how to deal with anxiety and stress, as well as helpful tools for mothers to help them comfort themselves in times of stress. These kits are intended to be available for Leading Ladies mentors to give young mothers during times of crisis. Being able to equip these mothers with tools to help them support young mothers during any time of crisis can help save Black mothers and Black babies right here in OKC.
For crisis kits and conclusion.
Our Sunday school class helped us create crisis kits to be distributed to each of the leading ladies. These kits have tools and education to help them deal with anxiety and stress.
Each kit contains a journal and pen,
Stress aromatherapy,
a worry stone,
some mints,
herbal tea,
a whole lot of help papers,
and inexpensive comfort food recipes. All of these supplies and contact information for the leading ladies is in the description of this video if you would like to assemble and donate kits of your own.
With your help, we can try to lower the infant and maternal mortality rates in Oklahoma.
Together, we can make our community healthier, more educated, and empowered.
3, 2, 1.
Thank you.
You can cut that out.